One sec. Alrighty then. Okay, YouTube. Last week we had an echo. Hi, Donna. Please tell me, is there an echo? This time I'd be on a completely separate microphone. I haven't even turned on Facebook yet. I'm a little walking wounded today. Not my best. Alrighty. No echo. Yay! Excellent. That's what we like to hear. All right. Hello, everybody. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is September 3rd, 2023, and it is technically a holiday, and I feel like I deserve my holiday, but I felt strongly that I should talk about IC Awareness Month today just a little bit. And so my goal in doing these meetings is to make you so strong, knowledgeable, informed that no one can mess with you. I don't want anybody telling you that you're damaged goods. Hello, Annie. Yes, I will happily take your question. I don't want anybody telling you that there's no hope. I don't want anybody telling you that there's no treatments, because that's absolutely not true. There is hope. And remember, we don't even think of IC as an incurable bladder disease anymore. Rather, we think of it as a pelvic pain syndrome. Now, I'm very squirrely. I have to tell you right now, I'm very squirrely because I hurt myself. So I have my back hurts, my leg hurts. I was lifting rocks earlier this week, and then I was doing something else. And so what did I do? I hurt my shoulders. I hurt my back. I hurt my knee. I'm a mess right now. You just got to know I'm a little bit of a mess. So I'm going to try to last as long as I can. Hello, Elise. We are simulcasting live. If I'm looking over here, I'm looking at YouTube. If I'm looking here, I'm looking at Facebook. There we go. Annie says, about an ovarian cyst, is it possible that it can cause bladder inflammation? It kind of depends upon the location of the cyst. Is the cyst, if the cyst is creating a lot of inflammation, neuroinflammation, then that's going to certainly kind of spread to nearby parts of the pelvis, including potentially your bladder. I myself have had many ovarian cysts. We have kind of an interesting theory about that, actually. Let's see, I got to remember what the exact theory is. So, hi, Ann. Hi, Deborah. Okay, hold on. I got to think about this for a moment. It's an estrogen dominance thing because of a... Okay. Or imitate the pain. You know how I differentiated between bladder pain and ovarian cyst pain? It was very clear to me when I was having ovarian cyst pain, because I had pain when I moved my body. I had pain, very sharp pain, if I would go from sitting to standing, always on the left side, which is where I tended to throw my cysts, although I had them on both sides. I probably had a good 20 ovarian cysts. I had the most when I was in college. And I always knew, I mean, I was one of those people where I could always tell when I was ovulating anyway, because it hurt. And I would get that sharp pain either slightly on the left or slightly on the right. So every single time I ovulated back when I had ovaries, I knew it. Of course, I've had a hysterectomy now, so that's a whole nother story. But the way that I was really able to differentiate it, and I was able to narrow in on going, okay, I have a cyst growing right now, is I would get this kind of a searing, sharp pain when I went from sitting to standing. Now, getting back to that funky theory. So, Yeah, I'll give you a little history lesson here for a moment. And I want to talk about IT Awareness Month, and always go ahead and throw out your questions. So the IC movement began in the early 1980s, okay, and it was begun by a woman named Barbara Flanagan and her friend Lana. They were both friends of, patients of Dr. Lowell Parsons down at UC San Diego, and they created the original Interstitial Cystitis Association. Absolutely the original group. And their focus, Kayleen, me too, girl. I totally get the feeling, blah. I'm totally there with you. Their focus in starting their group was entirely research. They wanted to drive research. They didn't have the time to really put together support groups. They were much more focused on trying to contribute to IC research, trying to figure out what could be triggering IC, et cetera, et cetera. And they early on had a theory that some IC patients could be struggling with something called porphyria. And porphyria is a vitamin B12 processing disorder. And then you may all know, you may recognize the name Vicki Ratner. Vicki Ratner came along. She was a doctor who developed IC in medical school. And she created an affiliate ICA in New York. And so we had a California-based IC and we had a New York-based IC. And it was not friendly in a way. They were somewhat competitive with each other, although they were. I've talked with Barbara and I've talked with Vicki. Everybody had the best of intentions, absolutely 100%. But eventually, the California ICA disappeared. They just kind of gave up, and the New York ICA became the ICA you know today. I'm very happy to see that the ICA is supporting IC Awareness Month. This is great. They released a video a couple days ago. That was great. So anyway, you still had these very motivated people who were very focused on research and causation, including Barbara Flanagan, who for the last 30 years has been working with porphyria researchers. And I have shared her story multiple times in our magazine and on our website. It's very, very arcane, difficult science. I will tell you that half of the papers she sent me, right over my head, right over the great majority of people's heads, including doctors. Extremely advanced arcane science. Well, now we have another researcher who's kind of stepped forward and is kind of pursuing this a little bit more, the porphyria researchers. And again, this is not for all IC patients, it's just for a subset of IC patients, very, very small subset, most likely. And her theory, and I'm not going to say who that was because I don't think she's really talked about it publicly yet, is that when you have a B12 processing disorder, the pathways become estrogen dominant. And when you're estrogen dominant, what happens? You have the potential of throwing ovarian cysts, maybe even a little endometriosis or fibroid tumors. So tends to be an abundance of estrogen in the system. And there was a lot of politics back in the 80s. People had these theories, people had that theories. I can remember back when I got started in the early 1990s. I got started 10 years later. Everybody was a turf war. Some doctors were saying it's this, some doctors were saying it's that, some patient groups were saying it was this, some patient groups were saying it that. There was very little in the way of listening to each other and collaborating with each other. I can remember when I used to go to international IC events, I spent most of my time apologizing because as soon as they heard that I was from America, they were like, oh God, another American. Because the Americans at times were so bloody arrogant and insulting. Because back then, I guess people were assuming America was going to find the cure and America was going to do this and America was going to do that. And the Americans, to be quite honest, got extremely cocky. So the challenge that we have now, we have to admire Barbara for everything that she's done because she is pursued this like a dog for the last 30 years in the best possible way. And she's got very top researchers who are looking at it without any money and support at all. And without also being able to get support of the typical IC leaders. But again, now we've got this other group that's kind of working on it. And I think that it's interesting. And as we consider the concept of phenotypes and subtypes, it's important to know. So I'll tell you this week. Okay, you want to hear something freaky this week? Freaky, freaky, freaky. Working with patient, severe IC, had it for 3 years. And she's got the weirdest diet sensitivity. What's happening over time with this patient is that she's becoming more and more intolerant to protein. So she couldn't eat red meat. Can't touch it with a 10-foot pole. Now she can't eat chicken or turkey. She can't eat soy. And she's hanging on by a thread to chicken. And I'm like, and she's like, Jill, what is this? Is anybody else protein intolerant? And I'm like, no, that's unusual. And then I remember, so you follow my line of thinking here. So it's like, okay, did y'all see the story about 2 months ago of people who have gotten Lyme disease and they end up unable to tolerate protein because the Lyme disease has affected some sort of protein metabolism process? And there were some fairly big stories about that. And so I was like, did you hear about that? She's like, no. And I go, have you had any tick bites, anything at all like that? She goes, no. Do you live back east? No. Have you been in the forest? No. Have you been checked for Lyme disease? Yeah, my doctor did anyway. No Lyme disease. And I'm like, okay. So then what's my favorite question? What the favorite question that I ask patients is there any event that you associate with the onset of your symptoms? She's like, no, not really. And I'm like, didn't fall? No. Have a baby? No. Were you traveling? Yes. Oh, big traveler all around the world. Where'd you come from? Oh, Central America. Oh, were you swimming in rivers? Yeah. You know what I think she has? So we sent her off to an infectious disease specialist. I think she's got a parasite in her bladder wall. And so here we're just having this very dynamic conversation, looking at this, looking at that. We find the parasite. We find, it's like, okay, endemic to where she was swimming. And when you think about, our goal here is to try to find underlying causation, hadn't responded to any bladder therapies at all. Severe pain, almost crippling pain, getting worse rather than better. Protein intolerance is getting more and more crazy. And you're thinking, okay, the Lyme disease virus, but oh, wait a second. Could this be a parasite? Bet you $100 it is. Send her off to an infectious disease specialist. That was the only thing that could make sense. Only thing that could make sense. Annie says porphyria. Yeah, but there are lots of different types of porphyria. Let me spell this. I can spell it out for you and you can Google it. I'm just going to tell you right now, the science is very arcane. It's very difficult to understand. And I'm no slouch. It's very difficult to understand, even for me. Okay, now you guys know that I usually do my 30-minute intro and then take your questions, throw out questions, because I've got my heating pad right here. This is my heating pad. I'm living on my heating pad right now. And it's all dirty, but it works. Okay. What I wanted to do, in case you've been following what I've been posting on Twitter and what I've been posting on Facebook and Instagram, it's a brand new series of TikToks and graphics for IC Awareness Month. Because this is our tool. This is the way we can raise awareness. And so if for those of you who are on Facebook, you can scroll down and you can see the 2 that I've already put up, and you can share those, and please do share those. We have got to get the word out because there are patients right now suffering in silence at home alone. There are patients right now who think that they will never get better. Donna says she saw it on Instagram. Good, 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 good. There are patients right now who think that their only hope in life is to just use pain medicine because they don't know and understand some of these new causes and this whole concept of cause versus effect. And we have got to find them. We have got to reach them. We have got to give them hope. Guys, you know what it's like to be at home in the middle of the night crying your eyes out. Come on. We've all been there. I've been there. We don't want anybody else to go through what we've gone through. We want to try to reach them as quickly as we can, give them the information as quickly as we can, get them back to the doctor with the right set of questions, and hopefully fix the underlying cause. So what I wanted to do in this meeting is I wanted to go through our first 10 IC awareness daily facts, and then next week I'm going to do the next 7. I'm going to do 7 or 10 at a time. So I've been working my tush off for the last 3 days, working on all these graphics. Let me tell you. So IC awareness daily fact number 1. Did you know that IC affects millions of men, women, and children around the world? In the United States alone, our research estimates that 3 to 8 million women, 1 to 4 million men have symptoms of IC. And it's not a disease of older women. This affects children. This affects teenagers. And I'm going to say that probably in my office, the average age of the patients I'm working with are probably in their 30s. My symptoms started as a teenager. Now, remember, too, for those kids who have to get up and go to the bathroom, they're not necessarily going to tell you. It was my teacher who told my mother, hey, why does Jill keep getting up to go to the bathroom? Right? And now that we're starting school again, school's a whole nother story because for those students who need restroom access, it gets very difficult when restrooms are locked, or if you get detention for asking to use the restroom, as many schools and teachers are doing now. So let us remember that injury can happen to anybody regardless of any age. Men, women, and children, and there are millions. Now, another interesting point here is in Europe, IC is considered a rare disease, whereas in the United States, it's considered a common condition. And we're having a lot of discussions about that because in Europe, the only people diagnosed with interstitial cystitis are patients with Hunner's lesions. All the rest of us are bladder pain syndrome. And in the United States, we just call everybody IC bladder pain syndrome. Fair warning, we're probably going to stop using the name interstitial cystitis in the next 5 to 10 years. Okay? Because it's the wrong name. It doesn't mean anything. This was created back in the early 1900s when they thought IC was a problem with the interstitial layer of the bladder wall. Now we know it's not, that we have healthy bladder walls, the great majority of us. Okay, IC awareness daily fact number 2. An IC bladder may have lesions or injury that can cause severe pain. Not everybody, but some of you, estimated 5 to 10% of IC patients have Hunner's lesions. The rest of us, we're really probably looking more at a neuromuscular disorder because the great majority of us actually have normal, healthy bladders. And you're so stunned when they look in your bladder. Here you've been suffering, you've been crying for months or years, and they look in your bladder and they go, Jill, it's normal. There's nothing wrong with your bladder. And you're going, what? Impossible. Why am I up all night peeing? Please help me understand. Well, now we know why, because the bladder becomes a victim of something else happening in the pelvis, like a nerve issue or like a muscle issue. For me, in the end, it turned out to be a muscle issue. Well, a combination of both. IC awareness fact daily number 3, which is actually what I just said, and I haven't put these up yet. IC and bladder symptoms are often caused by injured nerves and muscles. That is correct. And interestingly, earlier this year, we had a you have to understand the researchers are always kind of um, credibility checking what patients are saying and double checking and triple checking. And sometimes they're pursuing things that research that you and I might think are like, why are you wasting time doing that? But there was one study that was looking very specifically at symptoms, like what is causing the symptom of frequency, urgency, pressure, pain. And you would think it's from the bladder, and it's actually most strongly associated with the pelvic floor, that the pelvic floor dysfunction directly triggers those symptoms that we feel is coming from our bladder. And I have got, let me see, do I have it right here? I was just looking at it. There's an interesting paper on that with some really good pictures that I could show you, but I'd have to dig to find it. It's somewhere here. Okay, I see. Awareness daily fact number 4 is what we just talked about. Tight pelvic floor muscles often cause frequency, urgency, pain, and that most importantly, physical therapy can be very, very helpful. IC awareness daily fact number 5. Ketamine cystitis occurs with long-term use of ketamine. It can be very damaging to the urinary tract. Why do we say that? This is a very interesting story. We had an international IC group starting over in Thailand. A very motivated patient. I was helping her, and she had her first support group meeting in the country of Thailand, and she was shocked that it was filled with ketamine addicts. There were like 2 genuine IC patients. The rest were actually people using ketamine. And she called me and said, "What do I do? These aren't the people I thought I was working with. These are addicts." And this actually ended up kind of dovetailing. We had a lot of new research from the United Kingdom, from Canada. It turned out that ketamine has replaced heroin as a drug of choice around the world because it is cheap. It is an animal tranquilizer. When you take it, you kind of float. And so it has gained popularity around the world rapidly in the last 10 years. The problem with ketamine is it acts as an industrial solvent to the urinary tract and to different parts of the body. And literally, the bladder wall gets destroyed. The kidneys can get destroyed. The ureters can get destroyed. The first ketamine addict that I worked with was actually a producer in Hollywood, a film producer. And he had actually, with his group of friends, what they did is they would drive down to Tijuana, buy ketamine, bring it back, get high. And after a period of time, he noticed that he started peeing blood. But he noticed that he was peeing blood after he used the ketamine. And he could very directly see cause versus effect. He could very directly see that the ketamine was injuring his bladder, but he could not stop until he finally went through the Dr. Drew rehab program. And that's what got him to stop, but the damage was done. And what our research shows is for people who use ketamine and who are psychologically addicted to it, some lose their bladders completely. They have no choice. The bladder is so profoundly damaged that it has to be removed. And the patient, even if you tell them your bladder is getting close to being removed, they can't stop doing it. Such is the tragedy of drug use, right? Recreational drug use to that extreme. The challenge here is that ketamine is also valuable from a pain care standpoint. Ketamine has been used in end-of-life pain care for many years because this is somebody who's very close to death. They're suffering, and we want to try to ease that suffering. And so for those patients, using ketamine is not considered risky because they're not long. They're not long for this world. I mean, within a week or 2, perhaps they may pass. Um, um, but there are kind of expanding uses for ketamine right now. We're starting to see a little bit more use with depression, a little bit more use with anxiety, a little bit more use with chronic pain. And so, what I just say to everybody is listen, if your doctor has prescribed it and we've got a valid use for it, absolutely worth a shot. But you gotta have a laser focus on your bladder, because if you're showing any urinary symptoms at all, that's a sign that it's potentially damaging your bladder, and you're going to need to back off on it a little bit. So the IC Network has a ketamine cystitis website, ketaminecystitis.org, where you can learn a lot more about that. There are many studies now proving the damage. Very limited treatment. It's same treatments as IC, but as long as you're using the ketamine, it's like drinking a massive amount of diet soda every day or soda every day. It's just going to cause a lot of damage to the tissue. IC awareness daily fact number 6: coffee, tea, soda, citrus, acidic foods can trigger symptoms. You need to avoid these for at least 3 months to give your bladder some time to heal. IC awareness daily fact number 7, very close and near and dear to my heart. Hi, Sandy. Hi, Judy. Children see and hear everything. Talk with them about your IC to ease their worries. Okay, so I had a young mother call me, very upset a few years ago. She was despondent because her young daughter asked her if she was dying. Asked her if she was dying because her young daughter could see that she was in pain. Her young daughter knew that she was going to the doctor, and yet the mom never explained what was happening. And so we had this very young 5 or 6-year-old who started to worry that mommy was going to die. And finally, one morning, she was sobbing, "Mommy, don't die, don't die." This is a true story, guys. Absolutely true story. And that was a very powerful learning moment to me. And it was a very powerful learning moment to the IC world, because it reminds us that children see and hear everything. They might not understand it, but they know it's happening. And you shouldn't hide your pain from your children. You shouldn't deny them the opportunity to learn about how to care for a family member who's not feeling well. And I wrote a book on this called a book inspired by this. Let me see if it's in here. Hold on one sec. It's got to be here somewhere. Is it in here? Nope. Okay, let's see if it's in here. You guys, I have all these magazines. Oh, here it is. Okay. So after this conversation, this heartbreaking conversation with this young mother, I was just absolutely determined to never let this happen again. And so I got together with one of my mom's best friends, Marge Trusolino, bless her heart, wonderful teacher. And we created this book called My Mom Has Interstitial Cystitis, A Painful Bladder Story. And we hired a beautiful illustrator. So we've sold thousands of these. And it's all about giving you a tool and a resource that you can use to talk to your mom. Talk to your children. Hi, my name is Jan, and my mom has IC. Isn't she cute? And we talk about how to pronounce it, interstitial, right? And here's meet my mom, right? Lots of love there. My mom hasn't been feeling well because she has IC. On bad days, she has to stay close to a bathroom. Sometimes she can't sleep or go to work because her bladder is bothering her. Do you know what a bladder is? And then we talk about what a bladder does. And my favorite, the great bathroom hunt. My mom is always looking for bathrooms at, at gas stations, grocery stores, restaurants, and the library. I think she has every bathroom in town memorized, right? How many of you do? You know you do. It's very important that she find a bathroom, and we help her hunt too. You can find more bathrooms in hospitals, coffee shops, parks, and schools. Hold on, this is great. When we were hiking, she even went behind a bush. Luckily, she was carrying tissues in her purse that she could use. They came in very handy that day, and we still laugh about it. It's a funny family story. Do you know any funny stories? Right? So there's mom hiding behind the bush. Isn't that great? Okay, and then how my mom helps her IC. Number one, she watches what she drinks. She doesn't drink any coffee, tea, lemonade, orange juice, or even soda because they irritate her bladder. She drinks water or milk instead. Doesn't water taste great on a hot day? I like drinking milk too. Do you? She watches what she eats. My mom doesn't eat tomato soup, pizza, spaghetti, lemons, grapes, oranges because they are very acidic. She can't eat chocolate either, but she really likes vanilla ice cream because it doesn't bother her bladder. I like vanilla too. Yum. The nice section on doctors. Take the fear out of doctors, right? We got to take the fear out of this. Our family doctor is Dr. Bill, and he's great. He went to medical school to learn about legs and arms and feet and toes and tummies and noses and even bladders. I like doctors because, right, they try to help us feel better when we're sick. Do you know what an animal doctor is called? A veterinarian. That's a big word too. Can you say it? Try sounding it out. Vet, in, air, veterinarian. God, I love writing this book. My mom also sees a urologist. Dr. Kim is very nice. She helps patients with bladder and kidney problems. She also showed me how the bladder stretches as it fills up with urine, just like a balloon. Wow. Dr. Kim explained my urine should be clear and pale yellow. If it's dark yellow, that means I haven't drunk enough water that day and that I should drink some more. Dr. Kim asked me to tell my mom if it ever hurts when I pee. Peeing shouldn't hurt at all. If it does hurt, I might have a bladder infection. Ow. Right? That's Dr. Kim. Even moms need help. My mom needs extra help. Her IC makes it hard to do some things around the house. We all help out, even my baby sister. In the morning, we change out of our PJs and into our clothes and shoes. We brush our teeth and comb our hair. We make our beds. We feed our pets before we eat breakfast. Why? Because they depend on us for their food. If they eat before we do, we don't ever forget to feed them. We make sure that our pets have clean water for the day, and in the after breakfast, we put our dishes. Yada yada. Yada. Anyway, you get what I'm saying here. The rule in our house is if you make a mess, you clean it up. Do you help your mom? Why don't you ask her what you can do around the house to help? Make a list and put it on your refrigerator. Then we talk about some fun, IC friendly activities. And then I think the thing that the reason why I made this part of IC Awareness Month is that we have got to give kids some tools and resources that they can use when you're not feeling well. And things that they can do that will kind of give you a little bit of break and a little bit of peace, right? And so we have 10 quiet time things that you can do. Read, imagination power, write stories, you know. I like this. Hugs make everybody happy. So this is like a part coloring book. and just part book. We have a big word hunt in here. And listen, I wrote this book in 2007. So parts of it are quite out of date now. Okay. But still, for the story it's really, it's sweet. Okay. So again, getting back to our IC Awareness Month daily fact number 7, always remember your children see everything and don't hide it from them. Explain it to them so that they don't worry unnecessarily. Okay. IC Awareness Fact daily fact number 8. Some IC patients have had an unnecessary hysterectomy. My friend Diane, who helped me start the IC network, had an unnecessary hysterectomy at the age of 21, and it broke her heart. We now have patients who have sued, and they have won millions of dollars. Because one very famous case of a young woman who was in TRICARE, her husband was in the military. She had pelvic pain. She went in for a hydrodistension and a possible hysterectomy, but it all depended on what the urologist said. The urologist said that she did not need the hysterectomy, and the gynecologist did it anyway, and she got $1 million. That, that's something that we all have to understand, that Western medicine fails the typical pelvic pain patient because doctors play in their sandbox. They don't look beyond their sandbox. Urologists look at the bladder, gynecologists look at the reproductive tract, gastroenterologists look at the bowel, et cetera, et cetera. And they don't necessarily look at relationships and how things influence each other. And in the end, this gynecologist was laser focused and believed that this patient had a dysfunctional uterus, when it turned out her uterus was completely normal. The problem was actually in her urinary tract. So that's one reason why phenotyping and getting IC awareness out is important. IC awareness daily fact number 9. Whoops. You deserve the best medical care. Keep looking until you find a doctor to treat your pain. Okay? If you ever have a doctor dismiss you, if you ever have a doctor tell you it's all in your head, if you ever have a doctor say that there's no hope, that there's no treatments, if you ever have a doctor who is insulting or demeaning, if you ever have a doctor who just gives up, move on. Move on. You don't have to stay with somebody who mistreats you. You don't have to stay with somebody who demeans you and dismisses you. There are perfectly appropriate times to fire your doctor and go find another one. And so don't stay with somebody who is treating you poorly, and keep looking. You have to understand that there are three different levels of urologists and gynecologists. There's local, there's regional, and there's national. The local urologists are the ones that are in your community. They're general kind of plain Jane urologists. They tend not to have a substantial specialty. They're going to work a lot more with prostate cancer and prostate issues and men's issues and women's issues. I think we all know that. And it's completely normal to see a urologist for which they have no clue how to treat you, that you have your symptoms have exceeded their skill set. And we also have to understand too that their ability to travel is limited when they go to a urology conference to learn new things. Are they going to go to the class on IC? No, they're going to go to the class on cancer. They're going to go to the class that will help them save a life. And yes, I know that seems unfair. And that's why we use IC Awareness Month, to get as much new information out there as we can in any way we can. And you, the patient, are an important vehicle for us to get in that doctor's office, because you can walk in with stuff to educate them when they don't take the classes or they can't get to the class, right? And a lot has changed in the last 10 years. There are a lot of urologists, older urologists, treating IC out of old textbooks where the only treatments are Elmeron and DMSO. If you go to a urologist and they say, hey, I'm going to treat you with silver nitrate, chlorpactin, you, for God's sake, back away and say, what? Why? That's a treatment for IC. No, it's not. It's not even mentioned in the guidelines. This is an old treatment that strips the bladder wall that we don't do anymore. So you have to understand those local urologists are not necessarily going to have the most recent training. My philosophy always with my urologist was to walk in bearing gifts. I brought articles, I brought magazines, I brought anything and everything I could to my beloved Dr. Mark Klein, who was my first urologist with my IC, and I appreciated everyone. You have to walk in with an attitude of gratitude when they're nice. When you outpace the skill set of the local urologist, they then send you to a regional urologist. So in my case, that was San Francisco, which is 90 minutes away. Regional urologists are usually at universities. Regional urologists usually have a lot more experience working with complicated patients and complicated conditions like IC. And so they're the ones who are going to be probably your more dominant care provider for those of you who are a little bit more challenging. But some of you have skill sets that even exceed theirs, and you've got to go to a national doctor. And there are maybe 8 or 9 national doctors in the United States that specialize in IC and specialize in pelvic pain, and you can find their names on our website. So don't give up. And listen, if you happen to live within 2 hours of a national specialist, what the hell are you waiting for? Go to the national specialist. Because you will learn more from them in 15 minutes than you will learn from a local urologist in 10 years. Because they do the IC research. They attend every meeting. They're teaching others about it. And so I'm always shocked when I talk to patients in Michigan. It's like, hey, do you know about Ken Peters down at Corewell Health, formerly Boma Health? One of the top IC researchers in the world, right there, master diagnostician. If you're in Michigan, for goodness sake, and you're not getting good care, if they're within a 2-hour drive, for God's sake, make the 2-hour drive and go avail yourself of a true expert. And the same is true in North Carolina, Robert Evans in New York, Robert Moldman. Pennsylvania, you got Robert Eckenberg in Bethlehem, Pennsylvania, who's probably the nation's leading pelvic pain expert. We've got Elise Day. So we've got that handful of doctors that are really, really super, super experienced. So anyway, I just beg of you, would you please share, just keep sharing our IC awareness tips, okay? All right, so let me go back to some of these questions here. Kayleen says, Dr. Sonia Ephraim. Okay, we're going to try not to let's not say names of doctors who are bad because I don't want to get sued. But if you had a doctor tell you that you were a sicko, I'm glad you left. Hi, Danielle. Danielle said, I was told I had a prolapse by my urogynecologist. However, after she did it, I now have worse pain than ever. I've had doctors leave network, 4 of them so far. Now I'm just looking for someone very close by so I don't have to travel so far. I hear you. What you said was true about the closer the doctor is not knowing so much. Yeah, those local urologists. Hello, Jackie. Jackie is new here. And Jackie, hey, listen, that's a family name here. My brother is Jackie. My dad was Jackie. Hello, I'm new here. And recently just got diagnosed with IC. They want me to do a hydrodistension. Does that work? I don't really suffer from pain. I just have frequent urination or frequency and urgency. Feel like my bladder's full even when it's empty. Will that procedure help? That procedure is really only done when the diagnosis is in doubt, Jackie. If you look at our national guidelines, they don't need to do a hydrodistension unless they're just confused as to what's happening here. Doing a hydrodistension allows them to look more closely at your bladder wall. It allows them to look for something called Hunner's lesions. But if they happen to have what we call a narrowband imaging cystoscope, they can actually do it without anesthesia through a narrowband cystoscope that will also allow them to take a very, very close look at the bladder wall. In the old days, the hydrodistension was the gold standard for making a diagnosis of IC. Now that's been, sorry, that's the wind is banging a door back there. Now we know that um, um, the hydrodistension itself actually can trigger a false positive. So when you, so, okay, and I have pictures. Um, when you stretch the bladder, let's see, how do I want to say this? In the old days, oh, and you got to understand, medical care is very macho. It's just very macho. The doctors are very macho, even urologists, very, very macho. And 20, 30 years ago, man, the bigger the better. That was the goal here. And so years and years ago, they thought that if you stretch the bladder, you forcibly increase bladder capacity. And interestingly, patients felt better afterwards. Many patients felt better. Now, why would somebody feel better after a hydrodistension? Because when you stretch the bladder, you break the nerves. That's the nerves in the bladder wall just get stretched and they break. So the nerves that are giving you that sensation of frequency, urgency, pressure, pain are broken, but they always grow back. So you get a false sense that you're better because you might not feel symptoms for about 2 months, and then woo, the nerves grow back. And sometimes more nerves grow back than you originally had. And so hydrodistension as a therapy has fallen out of favor um, uh, rapidly. Another thing, getting back to that whole macho concept, is in the old days, they did something called a high pressure, long duration hydrodistension. What that means is they put a lot of fluid in your bladder for a long period of time. But when you do that, you rip tissue, you break things, you break the skin. And so you can get little pedicular hemorrhages on your bladder wall, little, what we call glomerations. And for some patients, it actually ruptured their bladder completely. And so they would have to have a catheter for 10 days as their bladder healed, or a week as their bladder healed. Well, in 2011, when our national AUA guidelines came out, they said, please don't do that anymore. No more high pressure, long duration hydrodistensions. For God's sake, you're hurting people. Today, what they're supposed to do is something called a low pressure, short duration hydrodistension. That means just a little bit of fluid for a small period of time, just enough to give them an opportunity to look in the bladder. So I had a low pressure, short duration 5 years ago. And and what did it tell me? That I have a completely normal, healthy bladder wall. That I am not a bladder wall patient. My subtype or phenotype is pelvic floor. When the doctor showed me the pictures of my bladder, he said, Jill, this proves once and for all, it was never, ever your bladder that was your fundamental problem. It has always been your pelvic floor driving all of your urinary symptoms. So, to sum up, a hydrodistension today, if you look at our national guidelines, is to be done if the diagnosis is in doubt. If, for example, you had a lot of blood in your urine, then yeah, I would definitely want somebody to look in my bladder. If you are in severe pain, I mean, my personal philosophy here is that, hey man, if I have severe pain, I want somebody to look at it. Tell me what's wrong. Please tell me what is wrong so that I understand what's hurting so badly. And so I'm of the position that I'm not against cystoscopies at all. If my doctor wanted to do one today, this afternoon, I would do it. I've had 2 already, and then I also had the hydrodistension. I'm not worried about that. I like taking it away from guessing into facts. And when a doctor can look in your bladder, you're getting absolute facts here. But it's going to be very important, hun, that you come on over to the IC Network website and read our section on phenotypes and subtypes, because we no longer believe that we're all the same. We no longer believe of IC as an incurable bladder disease. And this isn't from me, this is from the top IC researchers in the world, that there's distinct patient groups, and we each have their own unique treatments. So what do we know? Bladder treatments don't work for the vast majority of patients. Why? Because it's not the bladder for most of us. That 85% of IC patients have tight, injured pelvic floor muscles, and it's the muscles that are driving their symptoms. So in my case, I did bladder therapies for decades, and they never worked. I did DMSO, I did the antidepressants, I did the antihistamines, I did all that. Nothing ever worked for decades because my symptoms started when I was 14. I'm 63 now. Okay. What healed me was pelvic floor physical therapy. So I don't have those symptoms anymore. I don't. I don't have those symptoms anymore. And it's quite exciting. So we need to know what your group is. You are an anatomical mystery to be solved. We've got to figure out what your unique cause is. We don't want to chase the symptoms. We want to focus on fixing the underlying cause. It could be estrogen atrophy. It could be a pelvic floor injury. It could be muscle squeezing nerves. It could be chemocystitis from the bladder wall being injured through chemical exposure. It could be a viral infection. It could be a fungal infection. It could be a bacterial infection. We've got some great testing to rule those in or out now. We just have a lot of stuff we got to check off to try to figure out what's driving your symptoms. And if you ever want to talk, you're welcome to give me a phone call here at the IT Network. Tomorrow's a holiday, and it's my regular day off anyway. I don't have a lot going on this week, so feel free to call if you would like to chat. Let's see here. So Jackie is in Detroit, Michigan. Girl, Ken Peters, Royal Oak, come on. Master diagnostician, state-of-the-art women's urology center. If you have any doubts at all about what could be driving your symptoms, Ken Peters is a master diagnostician. He's fabulous. And I've sent professional football players to him. His skills are fantastic. Ah, that door keeps opening and closing. Loretta, hello, Loretta. Loretta says, since doctors all play in their own sandbox, where do we find these great doctors who think outside their boxes? I go to a huge medical center and they operate the same way. So sick of the myopic thinking. And you're in Pennsylvania. You've got Dr. Robert Eckenberg. Probably, again, in my opinion, the best pelvic pain doctor in the country in Bethlehem, Pennsylvania. And if you make an appointment to go see him, you get this extensive questionnaire because believe me, he is looking at relationships. So that's probably where I would go. Danielle says, I have a question. When my surgery was done, they put my bladder to sleep for 9 months. They kept bringing me back to the hospital. Here, hold on. It keeps my feed from Facebook keeps flying. So I start reading and then whoo, it's gone. They keep bringing you back to the hospital to fill my bladder up to see if it would hold, but it was still leaking. So is that distending the bladder because they had to do it 3 times and during that time I had a Foley? I just wanted to know what that was. They kept bringing you back to the hospital to fill your bladder up. Were you awake or asleep for that? And guys, I gotta go let me go put a shoe in that door, otherwise it's gonna keep slamming. Hold on one sec. All righty. It's a little windy here. It's a very weird week here. I gotta say, it was a very weird week. We had a major fire scare for 3 days, and it was my first fire scare without my dad. So, my anxiety level was just off the charts. And then I was lifting rocks, and I strained my shoulders, and I strained my chest wall, and I compressed a disc in my back, and then my right leg went numb, and it's like, oh, God. The only highlight of my week was that I went and had my teeth cleaned on Friday morning, and she thought I was in my 40s. It was great. And my blood pressure was low, which is, yeah. Now, granted, I took a little bit extra blood pressure medicine. I don't know about you, but I dentists are hard. Dentists are hard for me. I can tell you exactly why. I had a tooth fracture when I was in college, and I had to have an emergency root canal. It took 8 hours, and the doctor kept getting up every 15 minutes to go into his office for 5 minutes where he was smoking, right? Because he'd come back and he was just stink of smoke. He got busted for dealing cocaine out of his office the next morning. I had a root canal by a done by a cocaine addict. I'm telling you, the things that happen in life are just crazy. And that's when my dental anxiety started. And he lost his license, and I should have sued, damn it. I should have sued because the tooth was never right, but I didn't. Jackie Sutton said, "Had a scope, my bladder said it looks healthy." Good. Okay, so if your bladder looks healthy on the scope, then what we have to do is we've got to look beyond your bladder. So, Jackie, the question that I'm going to ask you that is my favorite question is well, number 1, how old are you? Number 2, how old were you when your symptoms began? And number 3, is there any event that you associate with the onset of your symptoms? Were you traveling? Did you fall? Did you have a baby? Did you have a bladder infection? So, how old are you? How old were you when your symptoms began? And is there any event that you think triggered your symptoms? Kayleen said, I had a hypertension cystoscopy 2 years ago when the endometriosis was bad. They say everything was good except my bladder was a little smaller than average. Was that just what you explained then? Yeah. Jackie said, I've had all the treatments, medications, Botox, nerve stim. Nothing has worked so far. Okay. Yes, I would love to speak with you. I have a few questions. Definitely give me a phone call. So Jackie, the fact that bladder treatments aren't working points beyond your bladder. So let me ask you this question, Jackie. Do you have any other pain conditions? Do you have IBS, vulvodynia, TMJ, fibromyalgia, migraines? Do you have any other pain conditions? Danielle says that they are filling her bladder with fluid while she's awake. I don't know why they're doing that in the hospital unless they're worried about something. I don't think that you would be asleep for a hydrodistension, honey. Hydrodistension. Think about how painful a overly full stomach is, right? It's like, oh my God, it hurts so bad. The same is true for your bladder. They're both hollow organs, and what triggers hollow organ pain is overly filling them. So a typical hydrodistension in the bladder is going to hurt like crap, and that's why you're anesthetized. So I don't think they're giving you a hydrodistension awake. Carol Ann just got through COVID, still recouping. Does that cause problems with this? Yes, it does. COVID cystitis is real. COVID cystitis was first documented in Europe within 2 months of the onset of COVID in that first wave. And hi, Deborah. Um, we know that COVID. Listen, guys, COVID is not a respiratory virus. COVID is unique in that it attacks the circulatory system. That's why so many patients with COVID have blood clots. From large blood clots that cause strokes and heart attacks to micro blood clots that a year later can cause issues. The blood clotting effect of COVID is stunning. So, the other challenge that we have with COVID, and I've had COVID too, is what we call the cytokine storm, this massive inflammatory process that happens throughout the body. And it is that inflammatory process that leads to really significant illness. So they have found those inflammatory markers in urine. They have found inflammatory markers in bladder biopsies, but they have also found the virus itself in the bladder wall in patients who had very, very severe disease. So if you are, for the patients who are in the hospital for a couple of months, where we're really seeing the virus penetrating throughout the human body, um, they have found living virus in the bladder. Um, Also, and then there's good news here too. So bear with me here. I know it sucks for me to be giving you bad news. Um, Another interesting thing that happened with COVID early on is some of the guys who got COVID couldn't get an erection because the COVID was affecting the blood vessels in their penis and basically causing blood clots in their penis. And so, as they were doing the research to try to understand why men were having trouble having sex after COVID, they were looking also for those inflammatory markers and they were also looking for virus. And they actually found living virus in the penis. And the patient wasn't symptomatic, but the virus was there. And so, we have a lot yet to understand about COVID and what it does to the human body. The good news for COVID cystitis is that it's short term. In our COVID IC study, 25% of IC patients who got COVID had no increase in their symptoms. 75% did. And of that 75%, a third reported very severe flares during and after their COVID infection. And it's, COVID cystitis triggers intense frequency, or not so much pain, just intense frequency, urgency. And then for the others, it was just kind of like a modest increase in their symptoms. But it seems to be fairly short term, 6 months, at the most a year, and then everything seems to calm down as that body-wide inflammation calms down. I you know, when I went to the University of California for my drug development pharmacology degree, my first quarter, I took a public health class. This was in 1980. 1980. I'm that old. And it was all about HIV/AIDS back then. And how they were terrified that HIV/AIDS would mutate and become airborne. And they were bringing in all these top researchers to do these lectures. And I walked out of that class determined not to have sex in college, which I failed. But anyway, um, it certainly takes the fun and games out. It took the fun and games out of sex and relationships for me personally, because we could see how devastating HIV was back then, and all the arguments and everything that it caused. I once had a lady say to me that babies born with HIV should be thrown to the side of the road. I kid you not. That's exactly what she said. And oh my God, I chewed her out. I chewed her out like I've never chewed anybody out before. Like that baby had a choice. And just like now, like, do we have a choice that we got COVID? No, we didn't. We got it. It was a tragedy. Millions have died, and we're still trying to understand it, but we're here. We're alive. We're kicking. We're working, and we're going to make things better. Okay, so COVID is surging right now. If you've got IC and pelvic pain, you got to protect yourself. Do not follow those people and go into big crowds without a mask. You do not need your IC to worsen for the next year. And we've got this new COVID. Even the US Open tennis championships is hit massively by COVID, and players have gotten sick. So protect yourself. Just protect yourself. All right. Kayleen says, I demand general anesthesia. I remember waking up and my bladder felt like it was punched by brass knuckles. I didn't feel that, but also I was already on massive pain meds from the hysterectomy. So Sandy here on YouTube is asking about this. This is available in the IC Network shop under books. And so we're always happy to send it. I should update it, but my to-do list is massive right now. But I thought we did a really good job back then. And the artist was fabulous. I was really happy to work with her. Okay, hold on a sec. All right, now listen, if I missed your question, just please understand that Facebook, it just constantly moves everything around and it won't let me scroll backwards. So don't be offended if I didn't answer your question. It just means I didn't see it because Facebook moved it. Yeah, see, like I can only go back like 30 minutes. I can't even get back to the first 30 minutes of the meeting now with any questions that were there. Okay, I'm ready for questions. Anybody else got any more questions? I'm drinking Gatorade because I got a little dehydrated this morning. I was sitting here getting ready, and I'd already walked and I'd already done stuff today, and all of a sudden I started getting a headache. I'm like, And then I looked at my fingers and they were like prunes. Like, oh my God, Jill, you have, and I realized I hadn't drunk any water. And so now I'm back. Let's see. Yep, almost back to normal. Kayleen said, I'm spending every morning almost being so sick. It's not helping that I'm either on my period or ovulating from this IUD. Yeah, it's just a weird time. Sally says, what is considered long-term use of ketamine? Oh, I think it's more consistent use. I would say for patients who are using it daily for 2 weeks, that would be considered long-term use. Ketamine became a very popular drug combined with ecstasy for raves 10 years ago. It is a big import from the drug gangs and the cartels. It's often cut into other stuff because it tends to make people feel better. So between the ketamine and the fentanyl, I don't know how anybody could possibly trust anything they could buy as a recreational drug right now. You have no idea where it's coming from or what's in there. It's heartbreaking. Heartbreaking. Lori says, how do I find a national specialist near me? I'm in Southern California. Honey, you don't have a national specialist in Southern California anymore. What you do happen to have in Southern California are some amazing physical therapists, including a physical therapist who I think is one of the best in the world, Stephanie Pendergrast, who's at Pelvic Pain Rehab in downtown LA. Danielle said, isn't ketamine a cat tranquilizer? That's what these kids are using. Yeah, exactly. Yeah. Sally said, like occasional treatment for mental health. I mean, that's different. That's going to be at lower doses. And the research shows that ketamine in low doses can be good for mental health. You just have to be I don't be afraid of it. I would not be afraid of ketamine. It's been around for a long time. And think about all the animals that have been tranquilized with ketamine. I mean, I'm not really worried about the occasional use of ketamine. I You just have to be attentive to any urinary symptoms. So if you start getting up 2, 3, 4 times a night, you're taking ketamine, you need to let your doctor know because they need to reduce the dose or give you a break for a week or two, right? Ketamine is, it's like I'm trying to think of a good example. Mm, it's kind of like artificial sugar, that the more you do it, the more you kind of like it without knowing the long-term health ramifications of it. The long-term health ramification of artificial sugar and non-sugar sweeteners is obesity. Clearly proven, tons of thousands of patients in research studies. For God's sake, if you're drinking diet soda because you think it's going to help you lose weight, you are wrong. You are so wrong. But the food manufacturers are deliberately triggering an addictive response because they want you to buy their product. They don't care if their sweet product um, damages your body. They have one goal, bottom line. They just want to make money and they're doing it off of us. And it's disgusting. So we have to fight back, we just can't. I just don't want to give these companies my money. I am so outraged that they knowingly do things that they know will lead people to severe suffering, but they don't care. They just want you addicted so you'll keep buying their product over and over and over again. That's sugar, that's non sugar sweeteners, and any combination of sugar and fat. The brain loves that, triggers the same addiction centers that heroin does. Ravonda says, I've read that threonate comes from ascorbic acid. Is magnesium threonate safe to take with IV? I have no idea. I take magnesium glycinate myself, and I don't take a lot of it because I don't like having loose bowel. But I will do that a couple of times a week. But I don't know about threonate. Kayleen said, I'm the kind of person is you don't talk to me until I've had my morning Stanley of Gatorade. It's the only way I can get out of the nausea to drink water. I got to tell you, Gatorade is magic for me. And I can remember as a kid, I had oral surgery and I wasn't doing well. My eye teeth had come in backwards. The inside was facing outward. And I had this very aggressive surgery to open up the gums, wrap wires around them, have them out of my mouth with braces as they slowly pulled them around. Let me tell you, it was torture. Anyway, I just wasn't doing well after the surgery for a couple of weeks. And the doctor said, give her Gatorade. And it's like, oh, it worked. And so now whenever I'm not feeling well, I just love Gatorade. But I dilute it. I usually dilute it, but my ice maker is broken. But I usually dilute it with ice, and I dilute it 1-to-1 with water. I just love my Gatorade, but I don't drink a lot of it. Maybe a small one a couple of times a week. Danielle says, I live in central New Jersey. Any good urogynecologist, urologist there? The nearest IC expert that you've got is going to be Robert Muldoon out on Long Island. The other thing that's happening right now, I mean, we have a database of doctors on the IC Network website, so you can always look at that too, is that some of our best, most brilliant doctors are retiring. We lost Chris Payne here in California. He retired last year. Lowell Parsons, I think, is almost completely retired now. And so now we're waiting for the next generation of kind of young guns to step forward and be our new round of IC experts. We don't, and right now we're still not quite sure, not as many as before. Again, Elise Day, DE, is one of them. I think she's back up at Harvard now. She was at Harvard and then she went and set up a pelvic pain program in New York, but I thought I heard that maybe she moved back. It's D as in dog, E as in Eric, a first name Elise, Elise. You could Google her and see where she is now. She's quite good. And ultimately, in the end, all I can do is just give you a name. It's how you guys relate to each other that matters. I could send you to the top doctor in the world, but if you don't get along with them, it's not going to be the right doctor for you. And so it's really about finding somebody that you gel with. Here, I'll type it in here. So Google her name. She's a urologist, Elise Day. Okay, I need to go use the restroom because I was drinking a lot of water. I'll be right back. All righty then. Danielle said, I'm losing hope to the point you're just so done chasing doctors. I know, honey. Oh, but listen, there's nothing harder than being your own advocate when you feel like crap. I mean, it is what it is. And yet the reality here is that we absolutely have to be our own advocate here. And you're a tough cookie. And I say this with absolute love in the best possible way. So please don't be offended by this, but you are the equivalent of a tough bitch in the best possible way because you're here, you're standing, you're alive, you're kicking, you're asking for help, you're asking for care, and you're an inspiration to everybody who meets you, honey. So you're not weak, you're strong. You've never been more prepared to deal with whatever happens to you than you are at this very moment because you are truly one day older and one day wiser. You've gone this far for a reason. There's going to be somebody out there that you're going to help tremendously because you've gone through this experience. And that ultimately is a gift, a reluctant gift, but it is a gift nonetheless. That I think when you face pelvic pain like this, it makes you a better person. It makes you a better mother. It makes you a better friend. It makes you a better wife. And that I think most importantly, you will never, ever, ever, ever walk away from somebody in pain because you know what it's like to be alone. You will be there. You will be there holding the hand of anybody that you love and care about who's going through pain because of this experience. And that makes you a goddess in the best possible way. Ava says, I was booked in for installations, received one, but missed my appointment due to feeling unwell. My urologist terminated all of my other installations. Oh, Ava, that's so odd. I mean, how was your response to that one? I mean, did you have any success at all with the first installation? And what kind of installation did they do? Was it like a, rescue installation with heparin lidocaine, or was it a DMSO? What'd they do? Oh, it's Day, D-E, and just D-E. The short one of the shortest last names I've ever had. Danielle said, "Thank you. It is hard, but I real feel good." I'm glad you feel the love, honey. Listen, I was exactly where you were. And it's I think one of the things that oh, I don't know if I would call it regret, and I don't know if I would call it anger. When I think back about when my pain was worst, and I had the IC, and I had the IBS, my vulvodynia, and my TMJ all in my 20s. I'm watching all my friends get married and having babies, and I would laying in the fetal position in the bathroom every single morning at 10 o'clock or 11 o'clock. Every single morning for years. And, you know, you're so God, I was thinking about that this morning because you're watching everybody have a normal life and you're not living a normal life. And it's heartbreaking. It's heartbreaking. I mean, it's just I was watching my friends get married and having babies. I wanted to be married and have babies, and it didn't happen. And I could have had IVF, but I didn't have any money back then because I couldn't work so much back then. Right? It's like I didn't want to bring a child into the world if I couldn't financially support the child. And I did have a miscarriage at one point in time. So um now that I'm older, like I'm so grateful that I'm not that woman anymore. I'm so grateful that my pain is gone. I'm so grateful that we found the answer. I'm so grateful that I didn't give up. I'm so proud that I chose to fight when a doctor told me I would be a burden on my family. Said, "I will prove you wrong, you son of a bitch. How dare you say that to me?" And that was the pivotal moment that made me better. Because up to that point, I was poor me, poor Jill, somebody make me better. And that's when I went, oh, he's not going to make me better. I came home and I studied. I studied for years. I read everything, even now, because I have to, because this is my job, right? But I want to. And information is power. Now, I got to say, I was working with a patient early last week who was kind of driving me crazy in a way because she wouldn't read anything. She wouldn't read anything. She's like, I just want to go to a doctor and have them tell me what's wrong, give me a treatment. I'm like, honey, it doesn't work that way. How are you going to know what to ask that doctor if you haven't read an article on IT? She's like, I don't want to read. I'm so angry about it. I don't want to. Don't tell me to read anything. Just tell me who to go to. And I'm like, listen, there's a fundamental problem with the way you're thinking here, and that is that this is 50% you, 50% the doctor. If you don't walk in with some basic knowledge about your body and some basic knowledge about IC in general, how are you going to make good use of your time? You're going to waste that entire first appointment. And, over this hour-long conversation, it was just like, I don't want to read. I don't want to, Jill. And I'm like, I don't care if you don't want to. You have to grow up. I didn't say grow up to her. Like she was behaving like a teenager. And it's like, come on, you're in your 30s. I didn't say grow up, but in my brain, I'm like going, oh my God, can you be any more passive? You have got to get in there and read about this stuff. And so that you can prep for these appointments, so that you can push your doctor if your doctor says there's no treatments, so that you know what your treatment options are, so that you can have a good discussion about pain care. Your ability to be involved is critical to your success. And I emailed her for free my book, IC 101. It's just like, would you read it? Just read it. Just read the first 3 chapters. Please read the book. Oh, I don't want to read it. Oh, come on, honey. A doctor isn't going to do this for you. It's your body. You've got to learn. I learned early on when I started being an IC support group leader that there were patients who would call and they would ask the same question over and over and over again. So it's, Jill, I have IC. What do I do? Spend an hour talking with them, going over the diet and all that sort of stuff and all that sort of stuff. I call back a month later, Jill, what do I do? It's like, honey, I know I just spent an hour with you. Did you not listen to me or whatever? And she's like, I forgot. Tell me what to do. Spend another hour with her. This is all free. 2 months later, she calls back with the exact same question. I'm like, now wait a second here. Wait 1 second. Why are you asking me this question? And ultimately, in the end, it was because she wanted me to do the work for her. She was not willing to do the work on her own. And that's when I cut her off. And I just said, listen, honey, you come to our website, you got to read. Oh, can't you tell me? No, I'm not going to tell you again. You need to read. Oh, come on. No, I'm not going to tell. I've already spent hours with you. I need you to absorb the information and start doing some stuff. Right? Guys, I mean, listen, I call it like I see it. I'm 50% of my job is to educate, 50% of my job is to give you a kick in the butt when you need it and try to get you to take action. Because it's about action in the end. And hopefully lead by example by showing you the actions I took. Ravonda said, I've noticed Gatorade has citric acid and sodium citrate in it, and I'm unable to drink it. What are some other things we can drink to keep our electrolytes up? You can do Pedialyte. Try Pedialyte. And really, it's going to be about eating a lot of bananas and things like that are going to give you good electrolytes. And remember, hon, I don't drink full strength Gatorade. I massively dilute my Gatorade down, massively. But I'm also pelvic floor driven. I'm not bladder wall driven, and so I can get away with that. Kayleen said, I had an appointment last Wednesday with my primary doctor so she could examine the hernia. Examine the hernia before the general surgeon consultation on Wednesday. We decided it's best I don't see the pelvic floor physical therapist for vaginismus until I have the hernia repair. I'm not going to stay abstinent unless the doctor says to. I'm relying on bladder installations to minimize the pelvic pain. I'm so frustrated. We're right back to square one. Girl, you are not back to square one. For God's sake, you are not back to square one. Kayleen, I say this with love. Think about everything you've learned. We know you have a hernia. You're going to get that hernia cared for. When that hernia is cared for, you're done. You're over. Right? Now we get to move on to the next thing that's going on, which is going to be your pelvic floor. We've got to work on your pelvic floor and your pudendal neuralgia. You know exactly what to do there. You know that pelvic floor physical therapy is going to be very, very helpful for you. But, you just have a long list. You have a list of stuff you've got to address. But you're good, girl. You're good. Think about how far you've come in the last year alone. Boy, I wish we could go back in time to, when we first met and what you were going through because you are a shining star of progress and you are an inspiration to everybody here. And when we finally get you to the point where things are massively better, you're going to be the most amazing case study that hopefully you will let me write about because I mean, I think that you have faced incredible struggles with grace, dignity, confidence, and also frustration. But you're doing the right things, girl. You're doing the right things. I'm so freaking proud of you. Loretta says, my IBS constipation does not tolerate bananas. What a flare. Interesting. Because bananas actually are fine in the great majority of IC patients. But if they flare you, they flare you. And that means your body just doesn't like it. So we're going to respect that. We're not going to push through that. So Ava, getting back to Ava and her bladder installations, they were using hyaluronic acid too. Ava, you must be in Canada or Europe, right? Because they're not using hyaluronic acid here in the United States unless they import it. So are you stuck in you're in Ireland? Okay, I was just gonna go, okay, I'm thinking United Kingdom or Europe, right? And so you have socialized medicine, and socialized medicine comes with its own unique challenges, right? Am I right? I just don't understand why they terminated all the other ones unless they felt that they lost the sequence. So, were they doing Ialuril, which is a combination of chondroitin and hyaluronic acid? And how many did they have scheduled? And also, Ava, what I really want to know is what's the health of your pelvic floor? How are your muscles? And is there any event that you associate with the onset of your symptoms? Like, oh God, like I wanna fly to Australia and start a national group in Australia. I wanna fly to Ireland, start a national group in Ireland. I wanna, fly all over the world and create resources for patients and educate doctors. I did a coaching with a gentleman with IC in Ireland not long ago. And another coaching with a gentleman down in New Zealand. So they were gonna do 6. Was it Ialuril, combination chondroitin and hyaluronic? Kayleen says the clitoromegaly has gotten better, but when I'm driving on these ridiculous Illinois potholes, there's so much vibration. It feels good in a bad way. Yeah, I still use lidocaine twice a day. My urogynecologist said I will never be completely normal. Yeah, they can't. They're not God. They can't predict the future. For all you know, it'll all be normal in 6 months. Kayleen, I don't know if you want me to describe what's happened, if or not, for the people on YouTube. If you want me to, I can explain what happened. If not, that's okay too. Loretta said you have the same reactions with egg whites and avocados. I seem to react to so many things. See, that's weird because egg whites are natural acid reducers, and avocados are just so benign. Um, Loretta, were you here when I talked about the patient that I was working with this week whose diet intolerance was focused on protein? Um, okay, Kayleen. So hold that thought. Um, so this is a patient not responding to bladder treatments over time. um, quite severe symptoms, getting very, very despondent. But her diet intolerances were just baffling because proteins were triggering her bladder. So the first protein that had to go was red meats, and then the second protein that had to go shortly thereafter was chicken, or yeah, chicken, and then tofu. And I think she's able to eat a little tiny bit of fish, but they're worried that that's going to go too. And when I asked her what she thought triggered her symptoms, um, no clue. But she'd been traveling to Central America. And I truly believe that she's got a parasite because she was swimming in rivers. You got to be careful when you're traveling. I have a lot of family in Hawaii, and when I was young, I went there, and we went on the slippery slide in Kauai, which is a river, and they've got a concrete like slide on it, and so the water goes through the slide, so it shoots you out over a waterfall, and you fall like 10 feet, 10 or 12 feet. Well, my mouth was open, and I swallowed it, and the water was brown. I mean, it was nasty water, but it was Hawaii water, right? Everybody was doing it. There were a lot of people there doing it. Yeah, no, I got a tapeworm. I was 18, just graduated from high school, had to come home and leave stool samples because I had a worm. Like the things that happen in life is just crazy. And so, you couldn't pay me to go into brown water anymore. That was so humiliating. Okay, so Eddie says chocolate seems to be my biggest IC flare. Well, chocolate is neurostimulatory. Chocolate's known for triggering migraines. It's got caffeine in it. It's got all sorts of irritants in it. I don't eat chocolate. If I eat chocolate, I get bent over and scream or cramping, which is one of the reasons why I was so sick in my 20s is I was eating a lot of chocolate back then, not having a clue that I was allergic to chocolate or sensitive to chocolate. It's like poison in my body. So you can pay me to eat chocolate. Well, no, you can pay me, but I could handle a couple of days of pain. But I don't eat chocolate. I just don't. So Kayleen experienced something that was very, very unusual. Her clitoris became very enlarged and swollen and agonizingly painful. And Kayleen, do we know why? I don't. You have to refresh my memory here. So, we talk a lot about PGAD, persistent genital arousal disorder, which is happens when you feel this painful arousal sensation. And the reason why that happens is because muscles are squeezing nerves. And so some pelvic pain patients struggle with this incredibly disgusting arousal sensation that hurts. But I call it one of the dirty secrets of IC because you don't want to tell anybody about it because you're afraid somebody's going to think you're getting some sort of sexual gratification out of pelvic pain, right? Oh, I had a tube, not long. I mean, maybe 6 weeks. It happened to me. Um, and so that's really a sign that we have a muscle that's squeezing a nerve. So, Kayleen, the star that you are, my dear, you just went to the whole next level because not only were you struggling with extreme sensitivity, but you also got very, very swollen. And maybe some doctors who are maybe not as gentle as they should have been. And now we have a whole nother source of pain in a young woman who would like to be normal and have a normal life and have normal relationships. And so, Kayleen's story is a story of perseverance. It's a story of um, somebody who um, has been very honest and open about her frustrations and her anger and her emotions, but at the same time, it's just like a living inspiration of how important it is that you just keep making those appointments, keep looking for those answers, keep asking questions over and over. The more questions you ask, the better. Why does this hurt? Why is it swollen? Why do I have this pain when I sit down? Why do I feel this weird arousal sensation? Why are bananas flaring me? Why are proteins flaring me? Right? Ask, action, satisfaction. You're never going to get satisfied until you take action. But you're not going to take action because you're not going to know what to do until you ask the fundamental question. Why? What can I do? What should I do? What can we do together to try to calm these nerves down, to calm these muscles down so that I feel better, right? Was that fair, Kayleen? If you would say it differently, tell me, and I will repeat what you want me to say. Anne said, "I'm going to pelvic floor physical therapy. Girl talks more than doing internals for me." Well, it's a little bit of both. You got to have the talking to have the education. But the hands-on work is important. Kayleen said, "Okay, it grew from heightened testosterone with polycystic ovarian syndrome. The urology nurse said that the testosterone probably caused random clitoral erections. Since I was walking a ton at work, that's what caused an overproduction of smegma. The smegma would pull back on the glands while the clitoral hood was staying. It was really painful. I always had to think of something disgusting." So smegma is let me get the correct. Smegma is basically natural oils that have just kind of congealed. They turn white or yellow. And they're oils from the sebaceous glands in your skin along with dead skin cells. So, Ava said here, "I have that arousal sensation. I never told my urologist. You were too embarrassed." Ava, honey, don't be embarrassed at all. If you have that arousal sensation, that means that you have muscles that are squeezing nerves. So have you had a pelvic floor assessment? I mean, it's actually, in kind of a funny way, ironic way, exciting. Because that's a very clear symptom of pelvic floor dysfunction. And so now what we need to do is we need to get your muscles checked here. That's so we call that in our phenotyping system, in Chris Payne's IC phenotyping system, IC subtype 4, pudendal neuralgia. So these are patients who have symptoms that are positional in nature. They might have pain when they sit down, which gets better when they stand up. They might have pins and needles, areas of numbness, or they might have PGAD or sciatica. If you ever have sciatica, pain that shoots down your leg, you got pelvic floor dysfunction because that's caused by your piriformis muscle tightly squeezing your sciatic nerve. So if I were in your shoes, I would go to my gynecologist and I would say, "Okay, so here's something that's been going on that I haven't told any doctor about because, frankly, I'm quite embarrassed. But I was attending a lecture online and they explained this. I get occasional moments of a painful arousal sensation. And I have learned that this can be caused by tight muscles squeezing the pudendal nerve. Can you please check my muscle health?" And let's get a gynecologist to actually put finger in your vagina, and touch muscle groups. And if they, a tight muscle feels like um, tight piano strings. In fact, I just had that the other day. It was very weird. First time I ever felt that. On painful beef jerky, tough, rigid tissue, where it's a normal muscle tone feels like a raw chicken breast, right? I feel like I need a hairbrush. Here, hold on. Hold on. Oh. All right. Um, Kayleen said, my urologist helped a lot with the cleaning. The clitoris glands is so sensitive that I couldn't clean it myself in case I'd pass out. Oh, yeah, totally. Trust me, even urologists have seen and heard everything. That's true. Danielle said, I shared my story with you as well with my intricate surgery in 2020. My family thinks I should get a lawyer because of the gross negligence involved. I think you should too, Danielle. I think you should too. You know, adverse events happen. This is why our AUA guidelines, the new AUA guidelines that came out last year, when they talk about surgery, they make it a point to say you need to work with a very, very experienced surgeon who's doing anything with your bladder. And it was the first time that they really made it a point to say, please be very careful who you pick to do your surgery. We need somebody extremely accomplished. Hey, David. Jill, did you say that you had to stop eating oatmeal because it bothers you? Oh God, yes. Oatmeal. The two foods that were massively tweaking my IBS were oatmeal and chocolate. Oatmeal is like, like no, 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 no. I don't want to see or hear anything oatmeal because I was having IBS, right? And the doctor said eat oatmeal, and this cramping was just getting so much worse. I mean, I'm not lying, guys. I literally was laying in the fetal position in my bathroom every morning with bowel spasm. And, I mean, I had the sigmoidoscopy, and the doctor says, Jill, you're just not getting enough fiber. Eat oatmeal. Well, believe me, I ate a ton of oatmeal. I ate oatmeal every day, getting worse and worse and worse. And it wasn't until somebody gave me a book on food allergies and food sensitivities that said, stop all your grains for a couple of days. And when I stopped all my grains, all my symptoms went away. It was like, what? And then they had you introduce grains one at a time. So rice was fine, corn was fine. I tried the oatmeal again. Bam! Next day I was in the fetal position. And the irony is, I could remember as a kid making oatmeal cookies and getting sick. So, and oatmeal intolerance is common in my family. I mean, we're Norwegian and Swedish by the Arctic Circle. Did they have oats? Were my ancestors eating oats? Did my body have an opportunity to develop a good way of metabolizing oats? And the answer is no. Oatmeal is like poison in my body. David said, it didn't bother your IC. It bothered everything, David. It bothered everything. I was in agony, not lying, for years because that damn oatmeal and that damn chocolate. And it was my sister who saved my life because she gave me the book, which I still have on my bookshelf. Yeah, here it is. This is the book which got me, which got my IBS completely under control. And this book was published in, I would have gotten it in 1981. Yeah. And this is the book. It said, it differentiated between allergy versus sensitivity. I was like, oh, that's not an allergy, it's a sensitivity. It means my body just doesn't know how to process it and it interprets it as poison. Yeah, so it taught me how to do an elimination diet, and dang, it worked. You guys, you have to remember that your body today is byproduct or direct result of what your ancestors went through, and your culture matters. I mean, my body was designed for seafood and a very, very mild diet. Now think about the blandest diet in the world. Come on, that's Scandinavia. It's what it is. And the same is true, but for the United Kingdom and Scotland and Ireland. I mean, what were our ancestors eating back then? They were eating fish and deer and berries once a year. We didn't have a lot of acid exposure. We didn't have rice. We didn't have oats. We didn't have coffee. We didn't have chocolate. And so we can argue very, very successfully that, at least in my ancestry line, we haven't had enough time to evolve to learn for our bodies to learn how to metabolize some of these foods. Now, that's very different than somebody who, say, grew up around the equator, or somebody who grew up in Africa. Chocolate comes from Africa, you know? So we are a direct result of our ancestors. And I think that's what makes food today so difficult, is that we're not eating. I mean, we're eating foods out of season from around the world, and we're getting exposed to a lot of foods that potentially our body just doesn't quite know what to do with. Danielle says, I'm Italian, Irish, mainly Indian, mainly with Indian and English. Yeah. I am 98% Scandinavian, like 1% Finnish, and 1% Western Russian. You don't get more Scandinavian than me at this point in time, which means I really need to go. I need to go meet my cousins. We found something crazy on ancestry.com. You're not even going to believe this. So a couple of years ago, cruising through ancestry.com, because I've got a cousin who's working on it. And I found somebody who had my grandmother's picture on her page on ancestry.com. And I texted her and I went, why is my grandmother on your page? It turned out it's crazy. This is crazy. So my dad's mom, she was the first child of Norwegians. And her father died when she was an infant. So she was sent to live with an aunt in Sweden, which is why she had two different last names. And we never really understood that. What we didn't know is that her mother had remarried and had all these children. We had no idea. My dad had no idea that he basically had a ton of cousins and stepbrothers and stepsisters. I mean, it was just, well, no, I mean, no, they would have been cousins. We had, like 3 years ago, we had no idea. We had all these living relatives over in Norway and Sweden. And so it was very wonderful that at the end of his life, he was corresponding with several of them. And I need to go over there and meet some of them, because I never quite felt that I belonged here. When you're a redhead, you're the one everybody teases. You're the one you tend to get left out. And I even had a crazy lady walk up to me and tell me that I was the devil's spawn, right? It was just, and my dream was always to just go somewhere where there were other redheads, and I would be my home. So I know I can do that if I go to Scandinavia, or if I go to Ireland, or if I go to Scotland or England. But ultimately, in the end, life is funny. David said, I emailed Natural Approach Nutrition about the prostate medicine and the cranberry. They said they are coming out with one without cranberry. Good. Oh, you guys, I got to tell you, we got some really exciting new products coming out. David, send me an email. You need to send me an email so I can send it to them. So, Best Supplement Company I've ever worked with in 30 years. Natural approach to nutrition. So incredibly impressed with this company, the CEO, their attention to detail, their attention to product ingredients, sources, all that sort of stuff. I am just stunned at the compassion, the knowledge, and the commitment to truly want to help people. And so they are working on. They started with IC products, and then they've got some products for men, and they've got a new product for reducing cortisol with blood pressure and stuff like that. I can't wait to get that because I want to try that myself personally. But the breakthrough product that they have right now that's been out for about 6 months is called endometrio, and it's for patients with pelvic pain from endometriosis and maybe ovarian cysts and things like that, and rave reviews at this point in time. So we're going to have several more products in the ICN shop that are so encouraging and so promising. And I say this because we all have to understand that traditional medicine is doesn't have therapies. I mean, we know that the vast majority of bladder therapies come with a host of side effects and adverse events, such as eye disease with pigmentary with pentose and polysulfate elmeron. And so it's our own American Urology Association who says, guys, consider the supplements before you do traditional treatments because the supplements don't come with the same risks. So we've got Bladder Rest, Bladder Builder, Cystoman. Those are allopath. Those are our top supplements right now by far. The allopath is getting really good success for helping patients with bladder wall flares, whereas the chondroitin-based products are helping some, but certainly not everybody. But a good 60% of the patients who are trying have tried Bladder Builder are reporting shorter flares, fewer flares, less painful flares, less pain in general, and just feeling better. And so we've got some really good viable options out there for patients that, especially patients who can't afford traditional therapies or they have doctors who are not helping them. Ava, it would be, given the fact that you've got the arousal sensation, I would go look for, I'm going to write it in your chat. Palmitoyl ethanolamide, which there's dozens of research studies with acute pain, chronic pain, surgical pain, fibromyalgia, burning mouth syndrome, you name it, they've studied it. Their IC study with PEA was nothing short of astonishing. 87% of IC patients using PEA reported a significant reduction of their pain and discomfort by month 3. That would be something that you should be able to get in Ireland that might help your symptoms while you're waiting to go get your muscles worked on. Because ultimately, in the end, we've got to get those muscles healthy. But the PEA might be somewhat helpful in calming those nerves down, and that's what multiple research studies have demonstrated. Danielle said, I found out through my grandmother's family that I'm related to John Adams. John Quincy Adams is Daniel. Oh, that's very cool. Danielle says, what supplement is good for painful vaginal aching? Well, again, we have to understand the underlying cause for that aching. If it's dry skin, then using that topical estrogen or using something like V-Magic. If it's from tight pelvic floor muscles, then we have to do the pelvic floor physical therapy to try to get those muscles to release so that they're not causing so much pain, so much muscle tension and spasming. If it's the quality and health of your skin. So the question is, what do you think is causing the aching? David said, if you email them, they will get right back to you. And you don't think my emails you're getting to here. David, email me right now and we can figure it out. Because I can tell you, just send a test message, then I can tell you if it's going through or not. I get a ton of email every day, so and I'm not so good at answering all of them. I just if you could see my inbox, you'd be shocked. Danielle, at a minimum, PEA, Peora, could potentially calm some of those nerves down. So I think Peora would be an interesting experiment. And I think you already ordered it, right? Danielle said, I had a doctor told me it was like in school. Oh, lichen sclerosis. So lichen sclerosis basically means that the nerves become very, very inflamed and the tissue turns white. We start not getting good blood perfusion through those tissues. I know this because my mom had it. And I was at every doctor's appointment with her, looking at her vulva with the doctor. And her vulvas were basically almost white. And so the treatment for that is going to be a steroid, clobetasol. So, did you try clobetasol? It's a strong steroid. Lindsay said, "Can BV cause UTI symptoms?" Yes. I've had IC for 13 years and haven't had a flare this bad. Went to urgent care Friday for UTI, negative UA, and now waiting for culture. Tested positive for bacterial vaginosis, though. Having to take everything in my arsenal and having been in remission for 2 years prior to this. Lindsay, I'm so sorry that you're dealing with such a severe flare, especially on a holiday, because we all just want to rest on the holiday, right? And you're feeling miserable. I'm so sorry. So, um, the underlying cause of bacterial vaginosis is ultimately going to be two things. It's going to be your natural flora changing with age, right? As we get older, the acidity changes in our vagina, becomes a little bit more friendly towards bacteria. Also, if you have more advanced estrogen atrophy, basically because the skin is drier and it doesn't have that nice thick coating of mucus, it's much easier for bacteria to actually reach the cell to infect the cell. So the quality and health of your skin matters. Uh, um, The second cause, let's see here, hold on a sec. I just got distracted. David, yes, I did get it. I got it, David. Um, what was I going to say there? It was one of the things I was going to say there. Lindsay says, I'm 29 years old, mom to a 16-month-old. Why, girl, you should not have bacterial vaginosis at 29. Are you on birth control? Sometimes your birth control can be so strong, it kind of puts you into an artificial uh, or kind of a mock menopause. And is this um, when did this start? When did it start for you? I mean, was it like 2 weeks ago? Danielle says she takes vaginal estrogen every day and she's still diagnosed with bacterial vaginosis and yeast in January. And the doctor put me on meds and left before I knew if it was gone. Yeah. Are you still nursing? Hmm. I mean, so concept number one, oh, okay. So the second question that I would ask you is when you had your baby, did you suffer any injury? Childbirth can cause tears in muscles. It can cause tears in rectum. Sometimes you can get a complete perforation all the way into the rectum, and that can basically start to seed uh, a bladder infection. So, how is that? Um, okay. So you had a small second degree tear, but you haven't had an issue in the last 16 months. Did you have sex? Go back to the 20th to the 23rd. Had you had sex? I think that 2 2 to 3 weeks ago was the last time. Well, so you could, understand that because women have short urethras, yes, the active penetration can push bacteria up into the bladder and cause a UTI. But the proof is going to be in the culture. Um, um, at this point in time, we're kind of guessing. We need the culture results to see what they find. There's some, okay. Have you been on antibiotics recently? Like, if go back in the last 6 months, did you take any antibiotics for colds, anything at all like that? I have an important reason for asking that question. Yeah, I know you're waiting for that culture, and you might need to get a next generation DNA urine test. But I want you to take me back in time. In the last 6 months or a year, have you taken antibiotics for any other medical condition? I say this for a very important reason because we have some new research which is helping us understand how antibiotic use changes the biome in the vagina and in the bladder that will perpetuate bacterial vaginosis. No, you haven't. You were on an antibiotic steroid eye drop for the last 2 weeks. Have you had COVID recently? Did you get the eye COVID redness thing? That was going around like in the last 6 months. More quite a few COVID patients were getting eye issues. Not okay. Um, so at our big annual American Urology Association annual meeting, oh, your eye was a chemical burn. Oh man, that's nasty. Danielle said when I stopped having sex, no more UTI, and I'm 49, being on birth control pills, I felt great. As soon as I was taking off the birth control, I found out I was perimenopausal at 43. Yeah, that happens. Lindsay said very stressful, which is why I'm thinking flare, but the pain and urethra symptoms are too similar to a true UTI. Lindsay, did you fall? Have you had any falls in the last 2 to 3 weeks? Were you riding a bicycle? Were you riding a motorcycle, a horse? Did you do any long car rides? Okay, when is your pain the worst? Before you pee or after you're done peeing? Um, so in other words, does your pain get worse as your bladder fills with urine and once you pee, you feel much, much better? Or is your pain worse after you're done urinating? So when is it worse? Before you pee or after you're done peeing? Before, and starting your stream is painful. Is it painful in your urethra? So where is the pain? Is the pain on the outside of your body, on your skin, like your vulva, or is it on the inside of your body? And if it's on the inside of your body, where? Is it in your rectum, your vagina, your urethra, or your bladder? Okay, Lindsay said it's in the urethra and higher up. Burning bladder after empty. Okay, the bladder neck. Okay. Um, have you changed your diet in the last couple of weeks? Were you 3 weeks ago? Were you drinking a lot of coffee? Yeah, I agree, Danielle. It does sound like a UTI. And of course, we're all guessing at this point in time. We won't know until she gets her culture results back. The question is what type of UTI? It could be a bacterial UTI or it could be a fungal UTI. Candida can grow in the bladder too, and candida can cause a lot of bladder pain. And that's research from our own National Institutes of Health who made that discovery that many IC patients flaring of bladder pain were actually had an overgrowth of candida. Okay, you cut down to the IC diet again. You barely eaten anything in the last 2 weeks. That's not good. You're convinced that this is yeast or BV in the urethra. Well, it's possible. So I have a really good blog on the IC Network website about the 7 causes of urethral pain. One thing you could check though, so your urethra is kind of like the size of your little finger, okay, for a woman. And halfway up on the outside of the urethra is a gland called the periurethral gland. It's like a sea sponge gland that wraps around the urethra. And it is what we call a homologue to the male prostate, that when you compare the structure of the female periurethral gland and the structure of the male prostate, they're identical. They're tissue homologues. So guess what? We women, we have a prostate gland. And like the male prostate gland, it can become infected. And it basically becomes a very, very deep, painful pimple. So, and it can become infected with a lot of biofilm activity, a lot of different bacteria living there at the same time. So you can tell if you've got an infection of your periurethral gland if you sit on the toilet, wash your hands really well. If you got gloves, put some gloves on, a little bit of KY, and just stick your finger about halfway up your go about an inch up your vagina and press on the front of your vagina because your urethra is in front of the bladder. And if you can just kind of gently touch it like this, right? And if you feel any deep, painful spots, and again, it's like the size of a green pea, but it's like a deep pimple. If you feel any tender spots right there, you've got an infection in that gland in your urethra. Danielle said, I used to be told a UTI without leukocytes being high enough to be considered a UTI. They call it cystitis. Yeah. You did it and it definitely hurt. Did you feel a lump? A small lump? Again, it's like the size of a large green pea. And it feels exactly like a deep pimple. No, it caused burning on the left side of my bladder, on the left side of your bladder. Okay. So here are the things we're going to think about with urethral pain. Okay, so the first thing we're going to think about is skin health. But at your age, you're so young. I just don't see skin health being an issue. You're not on birth control. You should have plenty of mucus. The second thing we're going to think about is an infection of the periurethral gland. The third thing we're going to think about is tight pelvic floor muscles, because you've got muscles, your levator ani muscles, which also wrap around the urethra. And a muscle that's working hard burns. So when I was 14, for example, it felt like I was trying to pee through a needle. and I was diagnosed with what we call a urethral stricture. So my urethra was very, very narrow. And back then, their answer was to do a urethral dilation. You stick a piece of metal in there and you force it open. And I had urethral dilations every week for about a year. Well, of course, back then, they didn't go, gee, why is it tight? They just forced it open. And believe me, it was not fun. Now, today, we ask that question. Oh, why is the urethra tight and narrow? Oh, because the levator ani muscles are very, very tight. And the fact that you had burning on one side of your bladder is kind of interesting because anytime we look at pain on the left side versus pain on the right side, it really, again, it opens up pelvic floor muscles, and a pelvic floor dysfunction is potentially part of this problem. So let me ask you this. When you go to urinate, can you start your stream right away? Or do you hesitate 5, 10, 15, 20 seconds before you can relax enough to release your urine? Can you pee on command, or does it take a while to relax enough to release? David says, can candida cause Hunner's lesions? No. No. Hunner's lesions have been connected to virus, not fungus. Lindsay said, sharp urethral pain from sitting to standing. I have bladder wall IC from UTIs in teenage years. It takes a while. Girl, honey, you do know what that is, right? That's pudendal neuralgia. If anytime you have pain that goes from sitting to standing or standing to sitting, that's muscle squeezing nerves. And so you had symptoms when you were a teenager. Well, now we know that for the great majorities of teenagers who develop this, it's muscle, it's injury or trauma. And Lindsay said, when I push more water, it's easier, but it's still not comfortable. Yeah. Okay. So again, so you've opened up something giant here. You have positional symptoms. That's not your bladder. Your bladder does not change when you go from sitting to standing. Your muscles and your nerves change when you go from sitting to standing. So, yeah, you need to. She said she's going to see a urologist on Thursday, and you're going to ask for physical therapy. Good. So, I had something very interesting happen a couple years ago. Now, so in high school, in junior high, I had frequency urgency. And now we know why, because I broke my tailbone and my muscles got massively injured. Right. So my foundation for all of my symptoms going way back was an old tailbone muscle injury. But of course, we didn't know that back then. So I had frequency urgency in junior high. I had severe vulvodynia in high school. Felt like I had a yeast infection all the time. Then I had the IBS in my 20s, et cetera, et cetera. And I had the bladder pain in my early 30s. Well, I would give anything to be able to go back in time and to have actually had a proper pelvic floor assessment, because decades wasted chasing bladder diseases and bowel diseases that were not diseases at all. They were the byproduct of an injured, traumatized muscle. And so I would bet you $100 that if you go back to when you were a teenager, when all this began, that you were injured in some way. And you wrote that you had this issue when you were pregnant. And, pregnancy hormones do all sorts of funky things to muscles. They get weaker. You got the baby pushing on nerves. You got the baby pushing on bladder, et cetera, et cetera. Danielle said she was told my problems stem from having my son in 1993 at 19, and scar tissue ripped into my bladder. Mm-hmm. Yeah. So, for example, when you were a teenager, were you involved in sports? Okay. Oh, this is huge. So, Lindsay, you crushed lumbar 1 to 4 in a car accident. Okay. Huge injury, nerves that are going to directly affect the bladder. You've completely fit the model of a teenager who develops symptoms after a muscle nerve issue. I mean, and so did you have any hip injuries or any side joint injuries and broken legs? Judy said, should we get tested for virus or bacteria even without Hunner's or UTI? Does that require a biopsy from the bladder or just urine? Just urine, honey. And you can do a next generation DNA urine test with a very tiny amount of urine, and that's the penultimate way of testing your urine. And I think that, you know, we end up guessing, and that doesn't work. It doesn't work to keep guessing. At some point in time, we need facts. And if you consistently think you have infection, prove it. Get the test. And the reason why I say that is because a lot of patients out there continue to self medicate with antibiotics, not having a clue the damage you're doing to your biome. And now we have new research that shows that using antibiotics over and over changes the biome, favors a very bad lactobacillus that can damage the bladder wall. So, what we don't want to do is we don't want to chase these symptoms with an antibiotic, guessing that there's an infection. Get your urine tested once and for all. And the next generation test will test for bacteria. It will show good bacteria, it will show bad bacteria, and more importantly, it will show fungus like Candida. All right, so Danielle, tons of sports for her. Lindsay, yes, it broke your sacrum. All right, so let me get my model. Yeah, girl. You are fitting, you're fitting it to a T, if I do say so. So, shall we have a look at the pelvis? All right, this is your pelvis from the front. Here's your pubic bone. Here's your hip bone. You have to remember the human body is designed so that the bigger the bone, the more weight it's meant to carry. That's why the widest bones in your body are your hips, because it carries the weight of your torso. Now let's flip it around. Let's flip it around and look at it from the back. So here we have the spinal cord, and we have the sacrum, which is this triangular bone. And you're going to notice 8 holes total in your sacrum, because the nerves come out of your spinal cord, come down here, and then feed through those holes, where they are then delivered directly into your pelvic cavity. You can see them right there, right? And they end up passing through muscles to get to wherever it's supposed to innervate, right? It's going to go down, nerves are going to go down your leg. You got some ginormous nerves, actually. And some of the nerves are going to break off and deal with your clitoris and your urethra and your bladder and all that sort of stuff. So, oh my God. Okay, Danielle. Both of you. I'm glad you guys are in here at the same time. Okay, so Lindsay had a broken sacrum. So that is just really just a massive trauma. It's a massive trauma to soft tissue. It's a massive trauma to muscles, because you were in an accident and there had to have been a crush injury from hitting something hard that crushes tissue. And then the other thing you really have to be attentive to is I want you to look at everything that attaches to your sacrum and to your tailbone, right? These are not passive. This is active. This is an anchor point for your pelvic floor. And so, depending upon where you broke your sacrum, that's going to directly affect your pelvic floor muscles. And the fact you say here, you go into remission for 3 years at a time without any bladder symptoms, and then you get bladder symptoms again because you have injured those muscles again. Pelvic floor muscles cause all the symptoms you're experiencing. Frequency, urgency, pressure, pain. You are a classic teenage onset. Now, and I would challenge you here, Lindsay, because Lindsay's also saying, I had many UTIs as a teenager. Some were bad and damaging. So I think I have bladder wall issues and a nerve entrapment. I'm going to challenge you that some of those UTIs were probably not UTI. They felt like a UTI, but they were probably pelvic floor flares. I was the same way. Whoops, I was the same way. I can't tell you the number of times I had my urine cultured. But back then, what would we do? We just call the doctor, hey, I have an infection. They'd phone in antibiotics. You wouldn't even get your urine tested. You just assumed it was infection, right? I mean, that was routine. It's still routine in many gynecology offices, right? So what finally proved it to me that I wasn't having infection over and over again was I got startled one day really, really badly, and I thought I had leaked. I thought there was a puddle, beneath me, but there was no puddle. But what I did is I locked down my pelvic floor muscles for a couple of hours before I could get home because I thought I was going to leak. And I gave myself one of my worst flares ever. And that's what proved to me that what I thought were UTIs were actually pelvic floor flares. And you also have to remember too, now you have the ability to check your urine with a dipstick test, right? So and you guys, I'm very casual today because I did not feel well this morning. So bear with my sweatpants here. It is what it is. Okay. So remember, this is a home dipstick test, an azo urine, a UTI test. And you basically pee on a stick. So you can see here that this stick has 2 pads on it. And you pee on the pads. You wait 5 minutes to see what color it is. And you can see this is my test one, right? So you can see that the bottom pad has a slight peachy color, and this one is lighter. This is an old pad that I actually used, and time has passed, probably a couple years ago. So the colors have distorted. Okay, but that said, so the top pad tests for leukocytes. The bottom pad tests for nitrates. So many of us are positive leukocytes, negative nitrites. So what does that mean? That doesn't mean a UTI. That actually means bladder wall irritation. And I can explain why you would have leukocytes in your urine. But if you ever have a double positive, so you've got 2 purples, like here, yeah, you absolutely have infection. So you just have to understand, and listen, I'm not doubting you at all. I'm just telling you that most of us have always thought, we all thought we had a lot of UTIs. And that's because we just didn't know until recently that muscles cause all of those symptoms. You're negative nitrites right now on all the tests. So that means that you're having a flare. That in all likelihood, you're in what we call a state of ischemia. You know, have you ever heard that term, ischemia? It's ISCHEMIA. Judy says, thanks. How do we send stars? They're in your Facebook. They're in your Facebook commands. I actually don't quite know. If you guys like these support group meetings, you can just come on over to the IC Network website and become a subscriber and get our magazine, the IC Optimist, right? That's the best way to support us. But we appreciate any stars that are sent also. You can also make donations over on our website too. So, okay, so Lindsay, ischemia. Ischemia. Ischemia means the blood supply is compromised significantly, usually by tight muscles. So if your bladder is supposed to get 24 units of blood a day and it only gets 10, are you going to have a healthy bladder wall? And the answer, of course, is no, because the bladder's not getting the oxygen and the nutrition it needs to be healthy, right? So our therapeutic priority for patients like that, and I'm absolutely in this group, is to restore blood supply. How do we do that? We do that with physical therapy. What I would do, I mean, if you are absolutely convinced that you have infection, and even if the culture comes back negative, I would ask for a next generation DNA urine test, because that is the penultimate test. Costs $199. You can order it yourself, but you will have to have a doctor sign the form. The flaw with the urine culture is it's relying on food. It means they're putting agar or some sort of food medium in a little plate that bacteria eat. And so the assumption is if you put urine on top of the food, that any bacteria that will start eating it will start growing it. The fundamental flaw with the urine culture is it will only culture out the bacteria that eat that specific food. And so urine cultures miss a ton. They miss a ton of potential bacteria. Whereas a next generation DNA urine test doesn't rely on growing anything out at all. It instead looks for DNA in your urine, and it will map the DNA, and then it compares it to the massive databases at, I think, the Center for Disease Control, to find the name of the bacteria that has that DNA. And the advantage of the next generation DNA urine test is it will also demonstrate any drug resistancies, drug resistant genes. Like for me, I've had this done twice. I had this funky drug resistance gene to aminoglycosides. And I'm a pharmacologist, and I have no memory of ever taking this specific type of antibiotic. None. And my only guess is my mother took it when she was pregnant with me, or they gave it to me in a hospital and I didn't know what it was. Lindsay said, I will definitely do this. I always wanted to anyway. Yeah, I mean, you got nothing to lose. It's data, it's facts. I don't attach any emotionality to it. This is about trying to understand what's in your bladder, good or bad. Hold on. And then, based upon the results that you get, listen, if you come back with normal flora, girl, then you don't have a UTI. It's going to go back to your injury and muscles and nerves. And honestly, again, I bet you $100 that's exactly what's going on. And the challenge here, you could have an infection because you've been in a state of ischemia for a long period of time. Your bladder wall's vulnerable, thus it's going to be more easily infected. But ultimately, in the end, until you get those muscles healthy and those nerves calm down, you're going to flare. Every time you hurt your muscles, you're going to flare. And that's the life that I live now, is that as long as my muscles are healthy, I'm good. But if I do something to tweak my muscles, then I'm going to flare. So, as an example, a couple of years ago, I got pins and needles in my vulva. I thought it was a yeast infection. I mean, it was bad. And over a week, it went from front to back, left and right side, and I felt like I was being poked by pins. Urgent care said it was yeast. I took antifungals, didn't work. Went to my regular gynecologist 2 weeks later. She thought it was eczema. She gave me steroids for 6 weeks. That didn't work. Got worse. And I literally was being poked by pins. That's exactly what it felt like hard, like ow. I finally got to a pelvic pain specialist to look at my record, and she goes, Jill, don't you know what this is? I'm like, no. She goes, honey, it's a pudendal neuralgia. Your muscles are tight again. You need to go back to physical therapy. And my answer was, what? I didn't know that a pudendal neuralgia could cause symptoms on the vulva. I mean, on the outer lips, at the hairline, the pubic hairline. That's where I was feeling it, at the pubic hairline. She goes, yeah, we see it all the time. You need to go back to physical therapy. I go back to physical therapy. The physical therapist goes, damn, you're tight, girl. What the hell? What happened? And we started physical therapy again. And then the other thing that the doctor gave me was a compounded lidocaine estrogen jelly to use where I was getting the pins and needles sensation to just try to calm those nerves down. And it worked. And it worked. So that's a really good example of how nerves and muscles can trigger some of these crazy symptoms. All right, Tammy says, after years of chronic suffering from UTIs, I've recently found a natural product that works well. It's UTI Clear Bladder Well. It's a tonic from Native Remedy. The relief I'm experiencing, it's such a welcome relief. Amazon carries it. Okay. Let's go look at it. It's always tricky when we get recommendations like with this, Tammy, because I'm not sure if you don't work for the company because it's happened before. So please don't be offended if I say that, because believe it, we've had a lot of salespeople come in and pretend to be patients. Let me see if I can find it on their website. UTI Clear for urinary tract health, 4.5 stars. All right, let's look at it. What's in it? And listen, girl, if it works for you, power to you. I'm not here to shoot you down in any way, because we all live in our own bodies and we all have different tolerances. It's a bunch of herbs, okay. Buchu, uva ursi, yarrow, lemon bulb. So lemon bulb calms your nerve down. Oat straw, bilberry, St. John's wort, and a bunch of different echinaceas. Well, it doesn't look like it can do any harm. I don't know how it would prevent a UTI, because it's not going to improve the quality and health of the skin. But maybe there's a metabolite in here that a typical E. coli doesn't like. I don't know. But if it's working for you, power to you. Lindsay said, this is actually really exciting for how miserable I am. This is amazing. Girl, we got you. We got your back. Okay, David said he thought the next generation urine testing was $350. It was $199 the last time I looked, but they might have increased the price. Where do we get the next generation form for the doctor? They send it to you with the kit. So you go to Microgen. In fact, I've got a meeting with Microgen this week, actually. Microgen DX for Microgen Diagnostics, or you can go to bladderhealth.org. And you can order it there. You just pay for it there. They send you the entire kit with the forms. Piece of cake, baby. And again, there's a lot of emotion over it. I mean, you have to understand that it's very hard for, you know, doctors to change and health insurance companies to change what they authorize. Urine cultures have been used for decades and decades and decades. And we all understand that they're limited, but there's tremendous resistance to change. There was a lecture last year at the AUA conference by Curtis Nickel who just flat out said the future for urine testing is next generation testing, next generation DNA urine testing. And I agree with that. I believe it is too. But there are some doctors who poo poo it. There are some doctors who don't know how to interpret the results. And sometimes what can happen with next generation testing is you can sometimes end up chasing bacteria. I interviewed Rick, the CEO of Microgen, and one of the questions I asked him is, how do you know when to treat with an antibiotic or not? So you've had your like for me, the last next generation testing that I did found like 3% E. coli. I did it after my hysterectomy, and the reason why I did it is my urine was really cloudy. I wasn't necessarily having bladder symptoms, but my urine was unusually cloudy, and I just didn't understand why. And I thought, you know what, let's do a next generation test, just check it out. And it came back fairly normal, except there was like 3% E. coli, and I think there was like 1% actinomyces or whatever. And because I was not symptomatic, I wasn't in pain, I wasn't peeing all the time, I made the decision not to take antibiotics because I didn't want to mess up my biome. And so when I asked Rick, I said, okay, how do you know when to treat? And I explained my situation. He goes, you have to look at two separate things. You have to look at the next generation findings and you have to look at the symptoms because you made the right decision. If you are not having symptoms, there's no reason to treat you with antibiotics and to mess up your biome. And again, we've got fairly new research from Dr. Ann Ackerman at UCLA, which shows that antibiotic use has the potential of creating the perfect environment for something called Lactobacillus iners to dominate the urinary biome. Lactobacillus iners is a bad lactobacillus, it's not a good one, and it damages tissue. And so Lactobacillus iners has been found to play a really significant role in bacterial vaginosis and now potentially for some IC patients. So there are people out there who say you need to take antibiotics. And now we've got this really new research that's going, oh, well, wait a second on that. Because when you take a broad spectrum antibiotic, you're killing all the good bacteria and the bad bacteria potentially. But now, for some reason, this Lactobacillus iners is like the first to grow back. And it grows in so quickly, it eats all the food and pushes all the good Lactobacillus iners out. So once you're stuck with Lactobacillus iners, we now have a really dysfunctional biome. And what they're showing is being dominant in Lactobacillus iners is associated with a very poor long-term outcome, whereas being dominant in Lactobacillus crispatus is associated with very good health over the long term. So why is iners dominant and crispatus not dominant? Well, for some reason, it's like a super powerful lactobacillus that gets into that biome quickly and dominates. It's like you ever have a freshwater lake that gets covered with green algae. And the algae just it just covers everything, so nothing else can grow. It's kind of what iners does too, but we have a lot to learn about iners also. So we have a lot of good research and good things happening right now. I'm really excited. I'm excited about the rest of this year, and I'm excited about next year. We've got fantastic new products coming from Natural Approach Nutrition, best in the industry, in my opinion. We've got promising new research. Lindsay says, what is my recommendations for a probiotic? I think probiotics are going to be all the more important. Now that we have this Lactobacillus annulus research, we want to make sure that we need to repopulate our body with good beneficial lactobacillus, not bad lactobacillus. Um, um, so for example, Bladder Builder is a supplement that's chondroitin for the bladder wall, but it also has probiotics in it, and that's, in my opinion, going to be our future in trying to repair our urinary biome. I know we're out right now. We had one really, really, really good lactobacillus a probiotic. Hold on, let me look. I think we actually took. Yeah, I actually took it out. Hold on. I think it's important to mix it up. I don't agree with taking the same lactobacillus all day, every day for years, because what you're doing is you're favoring only those species in that probiotic. It's important that we have diversity, and so I think mixing it up throughout the year, doing one probiotic and then switching to another one. And also remembering that the best probiotic of all is live cultures, which is why it's very important to do yogurt. I do coconut milk yogurt. I don't do dairy yogurt. Just to keep or kefir, if you like kefir, things that will give you good living beneficial bacteria. So let me look here. It doesn't look like we have it right now. So I would just go to Whole Foods or go to a natural food store that keeps their probiotics in the refrigerator. There are some very, very good brands. You just want to, in my opinion, mix it up. I hope that makes sense. And Tamia, I'm sorry if I offended you. I have to do that anytime anybody comes in and gives a link to a product. Like, All right, guys. Well, listen, we've been going for almost 3 hours. Considering I felt so bad when I started, I'm pleased that we've made it this long. I feel a lot better now than I did when we started. Lindsay said, love that. Thank you so much. I've been meaning to call you all week. Yeah, give me a phone call. Be happy to talk with you, hon. Be happy to talk with you. All right. Well, any other questions? Give me questions. As long as you have questions, I stay. I wanted to, for those of you, Lindsay, Jeannie, you're welcome, hon. Danielle, you're welcome too. Hold on. I'm not done yet. Hold on. Lindsay, just hold tight for a moment. First of all, girl, you need to buy this book now. It's called Breaking Through Chronic Pelvic Pain. It's on the IC Network website. This is the book that is going to help you understand all the ramifications from that accident and that broken tail and that broken sacrum. Okay. I promise you, this book will help you. And if it doesn't help you, I will buy it back from you. Okay. It is a phenomenal book. So the section on treatment strategies for pudendal nerve entrapment. So I just wanted to read you a couple of case studies. Okay, because this is filled with success stories. So hold on a second. Let me just see if I can. Okay, that's not done. although that kind of applies to you. But let me see if I can find a good case study for you. Okay. The patient treatment plan. Okay, so this is a section, a non-surgical strategy for treating pudendal nerve entrapment. Let's see. Treatment for pudendal nerve entrapment can be divided into non-surgical and surgical categories. Common sense dictates that we start with the least invasive therapies before advancing to invasive techniques or surgical procedures. This concept is especially appropriate in the case of pudendal nerve entrapment, since surgical results are not always satisfactory. Physical therapy is therefore the cornerstone of treatment at our center, both to avoid surgery and to alleviate persistent postoperative pain. To be effective in the long term, treatment must target not just primary physical changes in the pudendal nerve, but also the secondary changes that have occurred in the pelvic tissues, external muscles, and subcutaneous tissues, as well as biomechanical abnormalities that disrupt pelvic structures. That is you. For this reason, physical therapy is performed internally and externally in conjunction with nerve blocks, nerve mobilization to maximize the outcome. He says, after examining hundreds of PNE patients, I have found that they routinely present with one or more of the following secondary problems for which concurrent therapy is required. Number one, sensitive skin and restricted movement of the subcutaneous tissue in one or more regions supplied by the pudendal nerve. Most common sites being around the rectum, perineum, genitals, and sit bones. Oh my God. Can I just tell you how sensitive my freaking sit bones have been? Number two, trigger points and tension to the external portions of the hip rotators, the piriformis and obturators, pain in the lower abdomen, low back, thighs, and groin, biomechanical abnormalities, especially those associated with the SI joint. Hello, that's me. Pudendal nerve trauma creates inflammation, scarring, and fixation. Therefore, primary treatment is directed towards decreasing inflammation and swelling and mobilizing the nerve that is stuck in scar tissue. However, these goals can only be accomplished if we step back and look at the broad picture. Not only must we determine the exact site of nerve sensitivity, but we must also discover all of the secondary tissue changes that have created by the sensitized nerve. If these changes are not addressed, they can become another source of pain. When pudendal nerve is sensitized from trauma or stretching, it causes the attaching muscles to react by contracting, yada, 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 yada. Okay, so hold on a second. This is the book for you. Lindsay, take my word for it. This is the book for you. And as an example, I want you to look at this picture. Okay, so look, here's your sacrum. Look at the muscles that attach the sacrum. Piriformis muscles. You see that? Here's the obturator muscle, which is lower. Think about what would have happened to those muscles with a broken sacrum, especially if the sacrum or the tailbone has healed crooked, healed out of position. And to give you an example again, so this is a side view of the muscles coming out of the nerves coming out of the sacrum. And look at how they go right through muscle. You see that? So you can see that if this muscle, this piriformis muscle gets tight, what is it going to do? It's going to squeeze these nerves. I talks about internal release, yada, yada, da. Yeah, I mean, I'm telling you, this book is the bomb. I just wanted to see if there was an interesting case study that I could share. Talks about bicycle seats, which do the same thing. Think about a bicycle seat pushing right up into these nerves. Yikes. You shouldn't be on a bike now at this point in time after your injury. Okay, here we go. Let's see. I don't know if that's a right. Mm, no, this is not the right one for you. He says, I have found that the successful treatment of pudendal nerve entrapment can only be achieved by first identifying the root cause of the nerve pain, as well as any secondary problems that are contributing to the patient's symptoms, and then initiating comprehensive multidisciplinary therapy. It must be remembered that the level of pain the patient experiences is the sum total of a web of interacting contributing factors. These include nerve injury, muscle trigger points, subcutaneous tissue restrictions, biomechanical abnormalities, deficient pain modulators, stress, all coupled with the pain intensification and globalization of central sensitization. Typically, many, if not most, of the ongoing pain flares P&E patients experience can be attributed to the failure to address all of the interrelated factors that are woven into the problem. Okay. IC Network website. Go there right now. It's under books on the front cover of IC of you go to icnetwork.org, then click on our store link, which is in the menu above below the logo. And right on the front page of the store, you'll see a link to books, and our book IC 101 is the picture we use. Go there, you'll see it. This book is the bomb. Thank you, Donna. Donna says, so glad you're feeling better. Well, it's because I've been drinking my Gatorade and I'm not dehydrated anymore. Let's see. A little. No, a little. Jeannie said, I have good news. I had Hunner's lesions and had them full graded. And part of the vaginal sling removed, then Botox to the bladder. Also, many other treatments in between. I'm out of pain finally. Yeah, baby. After 10, oh, this is fantastic. After 10 months of pain management, I was getting up 20 to 25 times a night. Now I'm down to 6 to 9 times a night. I'm thrilled and thankful to be doing better. I look forward to even more healing in the future. This has been a 5-year battle for me, and the pain was awful. Just wanted to share a success story. Honey, I'm so happy for you. I'm so happy for you, Jeannie. This is fantastic news. Now we want to get you down to just 1 or 2 times a night, right? But you're kind of like Kayleen, girl. You're tackling lots of different things and you're fixing them. So well done, my dear. Well done. All right, guys. Well, I think we'll call it here. So again, IC Awareness Month, please. After we're done, I'm gonna go ahead and put up our daily fact for today, which is the 3rd. If you can just spread the heck out of these and let's get that knowledge out there, that would be great. And again, if you find these meetings helpful, please think about coming on over to the IC Network and becoming a member or buying something in our store. We have all the top supplements for IC. We've got heating pads, chair cushions, books, you name it, restroom access cards, low acid coffee, all sorts of things that I personally curate for you. All right. So I will wish you the best, and let's hope we all have a better week this week. All right. I'll talk to you later. Have a good one. Goodbye, YouTube.